So Edmonton corridor or zone, they've changed the name to corridors now. Even they love changing names. They love it. And I get confused. And sadly, I don't even know if it's corridor or zone yet. And then sadly, I don't know who's leading it. And I work in the system and I'm navigating it. But picture Edmonton, which takes a lot of out-of-patient transfers, because anybody that's sick that needs higher level care from Red Deer all the way to the territories, even northeastern BC, northwestern Saskatchewan comes into Edmonton. It's a big area. In fact, if you look at it provincially, Edmonton area takes 4 times more of out-of-zone transports than any other zone, which would be Calgary. So that right now, Edmonton zone saying, hey, we're in a crisis. But you can picture someone in Hinton or Fort Mac or up in the Northwest Territories is very sick that has to come into Edmonton. Because they totally disintegrated it, there's now nobody that can kind of say, I'll even make it even clearer for everyone's listening. There's 5 major hospitals in Edmonton. What's been happening in the last 4 weeks is picture someone sick in Hinton, dying, and really needs extra care. The doc in Hinton be like, I can't manage this patient. I'm stabilizing them. I got to get them to Edmonton. They'll phone the U of A, get an emerge doc on there, an internal medicine specialist, and they'll say, hey, we're full. We can't safely take you. Try another hospital. Phone the Royal Alex, same answer. Full of Grey Nuns, same answer. Misericordia, same answer. Phone the surgeon, same answer. Gone through all 5. Now you've got, and now what was happening is they would just be like, the person that was coordinating the call would be, U of A, you just got to take it. Doesn't matter if it's safe or not. And we transfer them in, and we do our best. And they would sit in the hallways. And sometimes they would have bad outcomes, and sometimes they would die. Yeah. And we were telling them that this was happening. It got to the point where now you think about this person in Hinton, all of Edmonton saying can't take it, and we can't force them in there. There's nobody to coordinate to say, hey, that patient in Hinton should be able to call Dr. Parks in Medicine Hat and the internist in Medicine Hat, and we can say, hey, we're doing okay right now. We have a couple extra beds and someone's dying. We can fly them down here. And we used to do that regularly as a big integrated provincial system. And that's just one example. There's other things we could do in a coordinated manner that disappeared because there's nobody. And so here I want to just say, so there's going to be people out there listening and saying, there's no way that disappeared. That couldn't have disappeared. I got to tell you, we not in the media. We advocated internally. Hundreds of doctors signed an op-ed saying we support this is chaos. We're in trouble. It's not just Dr. Park saying this. We advocated within it. No one could identify who's the person to help us with that example, for example. And then we go in the media, and it comes out, and people learn about patients dying, and it's really bad. And then it takes them 10 days to figure out which minister to answer that criteria. And even still, we have this acute care Alberta, and the CEO comes out and says, well, we're kind of working on that. We're kind of responsible for that. But in real time, in the day, when you have someone dying in Hinton or dying in Camrose or even dying in Brooks, and they need to go somewhere, you can't rely on it going up to some minister, 4 ministers of health, having them figure out and have it. That's how broken the system is.
We need someone to triage the system.
Yeah, and it's sad.